Hey everybody, my name is Dr. Scott Giacomucci. I'm a trauma therapist and educator and a certified EMDR consultant. And in this video, I wanted to revisit EMDR memory mapping and the floatback procedure, specifically in the context of phase 1 of EMDR, which is about history taking and treatment planning. So this is an area that I find many people come away from EMDR Basic Training confused by, and I've provided supervision consultation for dozens and dozens of trauma therapists that were recently trained in EMDR over the past 10 years. And this is an area that people get stuck at. And I've found it to be an area that's essential for the safe and effective practice of EMDR. So I wanted to make a quick video to revisit some of the basics. One of the risks that I've found in not doing effective and thorough memory mapping and identifying of targets is the risk of re-traumatization or of jumping in too quick, too soon with clients, of getting ourselves into a memory network that we know nothing about and a bunch of other memories emerging in the process that overwhelm the client and lead to emotional dysregulation. I've also found that the few times that I've seen someone really fall apart during EMDR and need to be hospitalized, have a dissociative break, regress into a childlike state, that most of those times can be attributed to poor assessment and crisscrossing memory networks, that we activated two traumatic memory networks at the same time was just way too much for the brain to process, and it led to the client decompensating. So really important to outline and organize those memory networks so that you know what you're getting into, so that you can contain the others while working on one. So again, this is part of phase 1 of the EMDR. To be honest, I really feel like phase 2 and phase 1 should be reversed. That first we should deal with what's named phase 2, preparation, which is the resourcing and coping skills and strengthening positive memories, before we get to the history taking and the memory mapping. But I'll make a different video about my thoughts on that. In terms of memory mapping, basically you're identifying a presenting problem. What's the issue? The issue is I struggle to trust others. Okay. Can you describe a recent experience where you struggled to trust others? I struggled to trust my partner. I didn't believe what they said was true. Okay. And then we use that presenting issue as an opening, as a portal to map out what might be a larger memory network of past memories, probably related to mistrust and betrayal, harm, abandonment, that are fueling the present day dysfunction. So there's a couple different ways of doing this, which are all outlined in the EMDR Basic Training Manual. The first way they outline is the simplest, where you just directly inquire, how long have you been struggling with this difficulty trusting others? What's the earliest you can remember? Earliest memory you can think of. Was there a time when you felt this way, that you struggled to trust others? And many clients will be able to identify exactly when that started, or they'll be able to list multiple other earlier memories. And you jot those down in your notes and start to conceptualize what this memory network might look like. And then you'll be able to identify which memories to target with the EMDR protocol within that memory network. Now, the second approach outlined in the training manual is to use the floatback technique, or the floatback procedure. And this is the one that I find to be the most thorough and really the best method to use. And so the first couple steps are the same in that you're identifying a presenting issue and identifying a recent experience related to that presenting issue. So let's say the client says, I'm noticing that, the 4th of July just passed and the fireworks went off and the loud noises, my whole body jumped and it put me into this different state of hyperarousal and anxiety and panic. Okay, so we would start to assess that recent event. When you think of that recent experience with the fireworks, what's the image that represents the worst of it? All right. What's the negative belief about yourself that comes up when you think about that now? Okay. What are the feelings and the sensations emotional feelings, physical sensations that come up related to that experience, the fireworks, the hyperarousal. All right. And then we'll ask the client to take a moment and perhaps to close their eyes if they're comfortable, to focus on that image that represents the worst of the fireworks, the negative belief, the feelings, the sensations, and then to float back into time to an earlier time when they were believing the same thing about themselves and feeling the same things. So we ask them to let go of that image of the recent event, float back into time. Let me know if you land on any other experiences where you were believing the same thing about yourself and you were feeling the same emotions, the same physical sensations. And during this process, I would repeat it back to them. Float back to a time when you believed that you were unsafe and you were feeling anxiety and panic and you were noticing tension throughout your body and specifically in your chest. And the client oftentimes will land on another memory and they'll say, you know what, there was this other time when, I was at this event and there was a really loud noise and I experienced the same reaction. All right. And I take my pen and I jot that down real quickly. Sometimes I'll get a quick SUDS rating, subjective units of distress, 0 to 10 right now. When you think of that, how disturbing is it? Oh, it's a 6 out of 10. All right. I jot that down and then I'll continue with the float back. All right. Let's keep going. Float back to an earlier point in time when you also believed you were unsafe, when you were feeling that anxiety and that panic, and when you were noticing that tension throughout your body, especially in your chest. Just let me know if you notice another memory. And the client might take a moment and find another memory. There was this thing that happened when I was a child where there was an explosion down the street and the house on fire. I say, oh, wow, how old were you when that happened? And right now, when you think of it, 0 to 10, how disturbing does it feel to remember that? Oh, it's a 9 out of 10 to remember that. Again, I jot that down and I'm mapping out almost like a timeline of memories within this specific memory network. So using the floatback memory to memory map. And basically, you can organize it lots of different ways, but the way I find most helpful to organize it is somewhat similar to this, where I'm identifying the negative beliefs at the top, feelings and sensations, identifying some of the presenting issues, the recent events, the past memories, and then I want to get all the way back to that touchstone memory. So what's the earliest memory in this memory network? The touchstone memory. This is the memory that we really want to get to and reprocess and desensitize because it kind of holds the key to unlocking and reducing the present day issue. So ideally, we would map out these memory networks. We would get SUDS ratings so we can assess which ones are more disturbing than the others. Sometimes there's a memory network with just one memory in it. And those are memory networks that EMDR is very quick to reprocess and desensitize. Other times we might be looking at a complex trauma memory network where there's a dozen or 20 or 100 memories within the same memory network, in which case we might have to spend a lot more time identifying and reprocessing and preparing to reprocess those memories. Sometimes we've got to do it one at a time, one memory at a time. Ideally, we work forward in time, starting with the earliest touchstone memory, and then the next earliest, and the next earliest, and the next earliest. And we keep on going and going and going until we get to the more recent events and the presenting day triggers. And then we do future templates in EMDR. Now, there are times that we might need to work out of order, but generally speaking, we want to start with the touchstone and work our way forward in time. If a client is ambivalent about EMDR, or you're newer in your training in EMDR, or you're unsure about the client's appropriateness for EMDR, their level of coping skills and stability and resources, or there's really specific memory that's not the touchstone memory that they're struggling with that they want to work on, those would all be reasons to start with a different memory other than the touchstone memory. But I find this form of memory mapping to be very helpful for me in organizing my thoughts and creating a treatment plan. And it really helps me conceptualize what's going on for the client, which memories are attached to which negative beliefs, feelings, and sensations. This is a helpful way of separating out those memory networks and getting clear on what is connected to what. So my EMDR trainer, he would say that cognition is the royal road to memory networks. His name was Dan Merlis. He's a EMDR trainer in Washington, D.C. area. And he really emphasized that negative cognitions, negative beliefs are really what unite the memory networks. So when I'm working within a single memory network with a client and there's a new memory that emerges in discussion or gets triggered in their daily life, one of the things that I'll do to discern if it's in the memory network that we're working on or separate is I'll check in about the negative belief, feelings, and sensations associated with that memory. If the negative belief, feelings, and sensations are the same or very similar to the negative belief, feelings, and sensations in the memory network we're working on, then I can feel pretty confident that memory is a part of that memory network. But if the negative belief, feelings, and sensations are different, then what I've probably got is a memory that's a part of a different memory network. And I need to be careful about opening up two memory networks at the same time. So I'll make a note of it and save it for later, contain that. Now, as a side note, there's another approach similar to the floatback procedure called the float forward procedure, where maybe you're starting with a touchstone memory that you know about, but you're not sure what it's connected to in terms of present day dysfunction. And that's where you can float forward using the same process, same script essentially. However, you're identifying the negative belief, feelings, and sensations of the past memory first, and then you're floating forward to periods in time, memories later in time, where the client was believing and feeling the same thing. You're just mapping out the memory network backwards. You're starting with the touchstone memory and working your way to other past memories and then present recent events and then the presenting issue. Now, like I mentioned in the EMDR Basic Training Manual, there's 3 different ways to map out these memories and gain, identify your targets. The third way is what they call an affect scan. And so in the affect scan, basically we're starting with a recent experience and we're asking the client to describe that recent experience, to hold that recent experience in their mind, noticing the emotions, the sensations in their body, and then scanning back to an earlier point in time when they were feeling the same emotions, the same sensations. So the affect scan is a little bit different in that it's not utilizing a negative cognition and it's more body and emotional based. And so this is another technique, you're kind of focusing on the physical and emotional imprints of the trauma rather than the visual and cognitive imprints of the trauma that the floatback procedure is more focused on. So these are different ways of mapping out those memory networks so that you know where to start and what you're working with. I hope that this video is helpful as a refresher in helping you as a EMDR therapist work with your clients and identify where to start and how to work with clients, especially clients with multiple traumatic memory networks. It's important to recognize that sometimes the memory networks can crisscross. And when they crisscross, we've got to be real careful that we're not jumping from one memory network to the other. This came up recently with a client of a consultee, the therapist I was supervising, who was working with a client that experienced an injury, trying to avoid the specific details to protect the client's privacy. Let's say the client was riding a dirt bike and the client fell off the dirt bike, crashed, and really hurt themselves. And that was part of the experience was attached to one memory network, the experience of crashing and hurting themselves. However, immediately following hurting themselves, they ran crying to their parent and their caregivers who saw the whole thing happen and were laughing. And in doing so, invalidated the client's experience of harm. They didn't realize that the client was really hurt and had minimized the hurt they had experienced. And it left the client feeling abandoned when they really needed comfort and a attuned and helpful response. And that experience of abandonment and minimization and invalidation was a part of a different traumatic memory network, even though it was the second scene of the same event. So It had a completely different negative cognition, completely different physical sensations and emotions. That experience is what I've been calling the trauma after the trauma, which I talk about in a different video on this channel if you wanted to learn more about that. So in summary, I really want to emphasize the importance of memory mapping and the usefulness of the floatback procedure. If you're an EMDR therapist, this is an essential skill and tool to have before you get into reprocessing and desensitizing any memories. You need to map out those memory networks, have a way of organizing and conceptualizing what's going on for the client and which past memories are attached to recent events, recent triggers, and presenting issues. This will make your EMDR approach much more organized, much clearer, much more effective, and much safer for the client. So I hope you found this video useful. If you did, I encourage you to rate in the comments anything that you found helpful or any future EMDR related videos that would be useful for you. And check out some of the other videos on this channel related to trauma, EMDR, and trauma-informed care.